As a broker for 35 years, as I'm looking at your plan, you're 40 to 60% less in premiums than traditional plans like this. And I'm just curious, internally inside of your own system, how do you make that happen? Can you tell us more about that?
You know, it's less about what we do and more about how we think about it first, though what we do is important also. But with most of the traditional options, people are thinking about just how they can spend less in healthcare. We don't think about it that way. We want to figure out what's the right spend and how do we get that right spend, and it always starts with what's the right care. So if we know the right care and we always get the right care for people, the cost automatically goes down in half approximately. And let me give you an example of that, because I know that can sound a little unbelievable. The system right now charges generally, $3,000 to $4,000, $5,000 for an MRI, especially if you're in a hospital system. We both know the fair price is closer to $3,000 to $4,000, maybe $500 in some markets. So the charge price is $5,000, the fair price is under $500. But what's the right price? Well, it depends. Do you need the MRI or do you not? The right price for an MRI you don't need is always zero. The right price for an MRI that you don't need when you really need a $25 x-ray is zero for the MRI, $25 for the x-ray. You apply that thinking over and over and over and over again, and what you find is just a lot of the spend just doesn't happen. It goes to zero. And it really doesn't matter what things cost if you can apply the zero charge where it's appropriate. It's just basically the stuff that every mom with a medical degree does already for her own family. As a matter of fact, every insider, every CEO, everybody who's next door neighbor is a doctor already applies that watchful waiting. Let's just do a little bit today, and tomorrow morning we'll see what's next. But when you walk into a doctor's office, you turn that doorknob and you show that insurance card, no, that's not what's happening. We have to do everything we can on that day, then you're there. There's no watchful waiting, because otherwise we might be dealing, next time we see you might be in a courtroom 4 years later. And we want to make sure we did everything we could, we thought out every scenario, and that quite often can lead to tens of thousands of dollars of charges that could be zero.
Well, thanks, Dr. Berg. This has been amazing, and we are going to be working to help many thousands of people enjoy the benefits of Redirect Health.
Thank you. Yeah, we need it, don't we?
We do.
Yeah. You know, I imagine a day coming very soon, and I believe it's possible today. We just don't know about it. Not enough people know about it, but I imagine a day very soon where any business owner in America who wants to, and I'm talking about small, medium-sized businesses. I doubt the corporations or big governments will ever want to, but any small business owner who wants to will be able to get health care, provide health care to their employees so inexpensively, so easily, that they'll want to do it. And they'll want to make it free for their employees and their families, not because of any altruistic reason, though I'm sure that will apply in some cases, but because it just makes great business sense. There's free market advantage that happens to be able to say, please work for me, I'll give you free health care, your entire family, when nobody else is doing it. So I can see a day, that's possible right now. So I can see a day when any American company that wants to can make healthcare so inexpensive, they'll give it away for free to their employees in order to have a competitive advantage. And imagine what happens, not only regionally in our, as far as our competitive advantage, but what happens to our country globally when we knock out this burden of healthcare that is adding another thousands of dollars to the price of our homes, the price of our cars, the price of our goods and services. Imagine what happens to our global dominance and trade. That's what I get excited about.
It's going to be an exciting time. There's lots of people who are going to want to hear that story.
Yeah, and you know, there's a lot of people talking about it now, and there's some big folks talking about it, whether it's Warren Buffett or Jeff Bezos or Mark Cuban or Jamie Dimon. There's a lot of people talking about this right now, and they're all talking in the right direction. They might not know the answers yet, but they sure as heck know the problem, and they know the basis, the root of the solution. And anytime I get smart people who are talking about the root problem and the root solution, I get excited. I mean, they've got capabilities that you and I won't have in 10 lifetimes. And I'm excited to see what they do with it.
Well, what a pleasure. Thanks again.
Yeah, thank you.